let's talk about this investigation that people don't do, this test that people don't do. And if you do this test, most of the times it's going to help you a lot. This issue that people just slumped and died, this issue that you heard that people just slept and they didn't wake up, and at the end of the day they find out that they had heart failure or they had issues in the heart, okay, and nobody knew. Please, this investigation is what you should not joke about. At least once in a year, you should do it once in a year. Then if you're hypertensive, you miss your doctor, you're supposed to do it as often as possible if you're hypertensive, okay, and it's going to help. And the name of this investigation is ECG. Okay, it's ECG, means electrocardiogram. It's an investigation that checks the electrical impulse of your heart, how your heart is working. Okay, there are people that have, it can dictate if and like a clot, blood clot, or plaque, like a fat deposit has blocked a part of the heart. Because like I told you guys about heart failure initially in the video I made about heart failure, is when a fat deposit or blood clot blocks a part of the major blood vessel. Blood can't get through. It's an emergency situation, the person might die. Okay, so this investigation will check if there is any irregularities in the heart, any irregular heartbeat or whatever that is going wrong. Okay, and the name is ECG. And funny enough, it's not so really expensive. You wonder when people say they've done their medical check, they don't do ECG. Yes, like many people have sent me their medical check. I've seen it with doctors I'm working. They don't do ECG. People that do their medical check outside, they don't do ECG. They just do kidney, liver, in as much as they are good. But this is a very important investigation for the heart. Most people don't even know that there's something you can check about your heart, and it's not really so stressful. It's just to put, there are some electrodes that will be put in some part of your body to check the rhythm of your heart. This is a very important message. Please, your wife, your children, your husband, your mother in the house, especially those that have hypertension, please make sure you do this investigation at least once in a year. But if you're hypertensive, you do it more. Okay, in Nigeria it should be like 15,000 naira. I don't know, depending on the hospital you're working, or 12k or 20, I don't know. Okay, but it's not really so much that you can do. So when you do the investigation, I'm not a cardiologist. Had it been his kidney investigation, I would have asked you to bring them to me, let me interpret, or give a nephrologist. So when you do your ECG, get the results, go and meet a cardiologist. Your cardiologist will explain it, tell you there's something wrong with your heart, and management will take on. Like this video.